So in my last video, I would be very keen to talk about your role as commissioner, as healthcare provider, as private sector, as community and voluntary sector, and as public. Because in order to achieve value-based healthcare, which I would like to define again, it means improving healthcare outcome with the same or less resources we have got in hand. This is not one organization or one person job. We need to work together. If I take example that if you are a hospital, what can you do? You can do a number of things. As I mentioned before, you need to understand, do you have a robust data? You need to ask the clinicians what sort of costing data they need in order to improve the outcome and decrease cost. You need to give the ownership to the clinicians to collect and collate the data so that they can trust on that data. You need to find the ways for clinician and finance managers to work together. If you are a commissioner, you need to be thinking that what is the most effective and efficient patient care pathway for that particular condition or for that particular patient group, so that you can achieve the maximum outcomes or improved outcomes by utilizing minimum resources when you buy services. If you're a private sector and you're providing your products to the NHS, you need to be thinking, first of all, you need to be thinking about the language, because if you're talking about value-based healthcare, then you need to be proving that your product is what is their added value to achieve the value-based healthcare. Is it going to improve the healthcare outcomes, or is it going to decrease the cost, or is it going to make the pathway more efficient? So they need to be very clear that which bit of the value-based healthcare system this product or this service is going to have an impact on. Voluntary and community sector is a very important sector. The recent NHS changes have given them an excellent opportunity to play a very effective role in the provision of the healthcare services. And for that purpose, they need to be thinking that how best they can bring their tacit knowledge on the table, because they were working for a number of years in the community before, and they understand the community better than anyone else. And they can have the social enterprise which can help to meet the need of the population. And I think that is the way I would encourage them, that they need to be thinking again on the data, they need to be thinking about the outcome, and they need to be thinking which bit of the patient care pathway they can provide effective services. So by doing that, they can add a wonderful value or important value to the value-based healthcare. Public at large, very important that we all should play our part by taking care of our own health, so that we can adopt healthy lifestyle, which will help us to stay away from chronic diseases. And if we do that, it means that we will have a less of a burden on the NHS, and it means that we would be achieving the value-based healthcare by our collective contribution. Thank you.